Welcome to today's webinar hosted by eLotus and sponsored by Evergreen Herbs. As your leading source of quality CEU content with a legacy of over 2 decades, we offer educational courses to help you elevate your knowledge and expand your skill set. With over 250 speakers, 900 courses, and a staggering 3,500 hours of continuing education, we are committed to providing you with the best educational experience possible. I'm Donna Chow, your host and your moderator, and I'm thrilled to be guiding you through today's session. Today's webinar is Fundamentals of Acupuncture Points, Integrating Tung's Acupuncture and TCM Principles, Part 2, presented by Dr. Henry McCann. In case you missed it, we covered Part 1 yesterday, and if you weren't able to attend, be sure to catch up later as it serves as the official first half of today's class. Today's webinar will run from 8 to 5 p.m. Pacific time with 4 breaks, and lunch will be from 12 to 1 p.m. To ensure an interactive session, set your chat preference to everyone and be sure to use the Q&A box for instructor questions. Our speaker, Dr. Henry McCann, is the author of Pricking the Vessels, Bloodletting Therapy in Chinese Medicine, and co-author of Practical Atlas of Tung's Acupuncture. Dr. McCann has been teaching Master Tung courses with eLotus since 2015. So to discover more of his courses, please visit his instructor page at elotus.org. Now let's go ahead and welcome Henry and start the class.
All right. Okay, so thank you, everyone. It's great to be back today. Thank you, everyone who participated yesterday for part one of our discussion for this weekend. So since some of you are joining us today for the first time and weren't necessarily here yesterday, I think I want to go back and sort of discuss a little bit about the background behind where some of this material comes from, or what was the impulse for me to sort of look at the material. So, for quite some years now, as Donna mentioned earlier today, since 2015, I've been doing courses here with eLotus, and I've taught courses all over the place on similar topics, where we discuss Tung's acupuncture, and oftentimes do it in the context of a specific topic, which is not a bad thing. I think it's a very useful thing for people to take home with them. So, for example, we'll do Tung's acupuncture for pain management, Tung's acupuncture for, I think we did one on endocrine disorders, on stress, digestive disorders. So all these specific topics. And when we do that, we go through and we have some time to look at sort of core basic concepts. But most of the time is going through and looking at point protocols and how do we treat specific diseases from the disease state perspective. Now, clearly, we have to discuss at some point, because we're clinicians dealing with disease states, we have to be able to sort of discuss disease state perspectives, because that's important for us. We need to be able to treat patients. However, what I've seen happening over time is that many people who come to the classes or come to the lectures, they have a hard time sort of wrapping their head around some basic core concepts. And when we have a hard time wrapping our head around basic core concepts, what ends up transpiring is that we learn some of the protocols as protocols and we apply them, but in the end have a hard time using them flexibly and then adapting them for specific needs of different patients when we're in a clinical setting, right? Because protocols, when we study protocols, they're there as things to look at, to give us ideas of, yes, maybe I can use it exactly as it is, but how can I potentially modify it based on what I'm seeing on the ground in my patient at any given time, right? So one of the things I wanted to do for this weekend, after having done the different types of specific topics for so many years, is go back and really drill down on core concepts and how can we look at core concepts through both the lens of the material we talk about that we label Tung's acupuncture, but then also through very core aspects of how do we practice acupuncture at a fundamental level, regardless whether it's TCM acupuncture, Tung's acupuncture, Japanese, Korean, etc. So that was the impetus for the creation of this specific weekend, right? So the other problem that I've seen in acupuncture education, since I've been teaching at the master's level since I think it was 2001 or 2002, I started teaching. So it's been a long time since I've been teaching at the master's level in the United States. One of the problems that I see, and this is not obviously going to be everyone's experience, but in many of the schools where I've taught, our acupuncture education today seems to focus more on memorization of single point actions and then point formulas. So this was part of the discussion we had yesterday. So if you're joining us today and want a deeper look at the concepts that I'm just briefly introducing right now, I'll encourage you to go back and look at part 1 at some point later. When I mean single point actions, what I am implying here is that many people, and again, this is not everyone's experience, but many people, and I'm sure people on listening today will resonate with this, will learn acupuncture by looking at single point actions and memorizing just 1 or 2 actions. So we all know, for example, that in the examples I gave yesterday, because they're the examples I give all the time, spleen 9 drains damp. That's great. Clearly it does that. Kidney 2 clears vacuity heat. Yes, it does that. But the problem, and if you haven't taken your NCCAOM exam yet, that is the answer you should stick in your head and memorize, right? That's an easy one. However, what that fails to do is it fails to take into consideration broader uses of points that we have in the traditional literature, that we still see in modern TCM textbooks. For example, we can use spleen 9 not only to drain dampness, but it also has the ability to treat frequent urination, not from dampness, but from things like weakness of the kidney or cold in the lower burner, right? So clearly spleen 9 does more than just drain dampness. And when we analyze it in a deeper way, we can start to see all of the connections that there are between that point, the larger channel system, different parts of the body, so that we can eventually use it more flexibly and in a wider way, right? And this is the fundamental nature of acupuncture. Acupuncture points are not single herbs. Acupuncture points have multiple effects on the body. They are sometimes bidirectional. They can be used to treat numerous different types of patterns. For example, kidney 2. Kidney 2, the main thing that we memorize for kidney 2 is it clears this vacuity heat. However, if we look at the specific indications, right, and this is where we're talking about actions versus indications, we see, for example, that kidney 2 also can treat things like cold type diarrhea. And it can treat other problems where the yang or fire of the kidney has a problem or is in a state of potential insufficiency. Okay. So kidney 2 is more than just clears vacuity heat. Kidney 2 has numerous functions. And that's where what I'm encouraging all of us to do is to look anew at this difference between actions and indications, or actions or functions and indications. So what an action is with an acupuncture point is how we describe what it does through a theoretical lens. For example, stomach 36 strengthens the spleen in the stomach, or kidney 2 clears vacuity heat, or large intestine 11 clears heat, right? The indications are the specific disease or symptom presentations that are associated with the points. And what we saw yesterday through quotes from both Weissman and Dedman's Manual of Acupuncture, Dedman and Al-Khafaji's Manual of Acupuncture, is that the association of points systematically with actions is a product of the 20th century, really post-World War II acupuncture. Now, I'm not saying that's bad, and we'll see today when we study point combinations, we will be mentioning specific actions that point combinations can accomplish. The problem is if we only memorize just 1 action or 2 actions maybe for an acupuncture point, then we sometimes miss out on the broader picture. The indications as the disease states that are associated with acupuncture points give us essentially, I like to think of them, and I would encourage everyone to think of them as miniature case studies, because these are conditions for which acupuncturists in the past, our ancestors, people who are much better at acupuncture than me probably, these are things that those gifted physicians of the past used this point to treat. So they give us a list of disease or symptom states that are associated with a particular acupuncture point. And when we look at that, we can use those to explore and understand the greater connections between channels, 5 phases, yin and yang theory, parts of the body, etc., so that we get a more flexible picture of how to use acupuncture. And then acupuncture becomes really interesting, right? I go to work every morning. Maybe some days I don't want to get out of bed as early as I do because, like I said yesterday, there's always that 8 o'clock patient who decides not to show up, but for the most part, I'm never disappointed that I have to go to work. I'm always excited that I get to go to work. It's not a have to go to work. I get to go to work because I find material so engaging and interesting. So that's one of the problems that I think is an issue with acupuncture education. And it's not just here, it's in many places. Now, the other thing that we see, or that I've seen in acupuncture education, is after we focus on memorization of point actions, then we basically memorize point formulas and not really deeply analyze point formulas. And that's what I'm going to try to encourage us to do. And that's what I try to do for myself when I open a book of protocols and say, okay, this is a list of points. What am I trying to understand from this list of points that goes with this specific disease presentation? So we memorize the point protocols or the point formulas, and there's less attention paid to the strategy in how we combine points for better effect. Because in the end, all of this is not just an academic exercise, but rather an exercise in trying to get us to understand how we can tease out better effect from what we're doing with patients to their benefit, right? Which will benefit you. The better clinician you are, the better the patients will be, the better the patients will be, the better your practice will be, right? So all of that becomes very relevant. The most common instruction that we seem to get when we're looking at point formulas, so creating our own point formulas. So part of this is to help us understand what's the logic behind traditional point formulas. And we're going to go through lots of point pairing today. Some of them are my own pairing that I use in the clinic. I don't know if I made them up at this point because I'm using them so long, or if they came from somewhere else. In the end, none of us makes up something. Very few of us make up something completely unique. So I'm not saying that I'm coming up with anything revolutionary or different. Some of the point pairings we're going to be looking at come from pre-modern literature, sometimes from contemporary texts, right? So we're going to look at point pairing and try to go in and analyze what's happening there. Most of the strategy that we tend to get in acupuncture school basically is surrounding this idea of selection of local, adjacent, and then distant points. And we're going to try to stop saying distal points because it's not always distal as an anatomical term, right? Sometimes it's just away from the site of the disease. Some systems of acupuncture focus mostly on, for example, distant needling, like Tung's acupuncture. So since we're not focusing only on Tung's point, we're going to see some local needling, some distant needling. Sometimes it's all distant needling. But regardless, that seems to be the most common sort of basic strategy that we're given when we're told to come up with point protocols or point formulas. So while sometimes this is taught in this piecemeal fashion, we don't usually offer our students any systematic approach to strategies around point pairing. And the topic of today is going to be specifically point pairings and not necessarily larger protocols or formulas. And we'll talk about what that means. Okay. So when we're looking at the point pairings, they're going to be the precursors to formulas, right? So we're going to look at, yesterday we looked at single points. Today we're going to look at double points. For the most part, we'll look at some maybe 3 points, but mostly double point pairs, and that will form the basis of formulas, which is up to you to study later. So if we don't give people a set of strategies that we can use to help them understand why points work together in a more harmonious way, we end up getting what some other colleagues of mine have called the spray and pray method, where you just throw in as many points as you possibly can and hope that something sticks. And I'm going to suggest maybe this is not the most effective way of actually going about acupuncture practice. Okay, so let's talk first of all about point pairing. And as I said yesterday, feel free to go ahead and put questions into the question box. We will try to get to questions throughout the day. Our moderator, Donna, in back will be helping me field some questions, and then we'll also answer questions as we go into break periods. Okay. So first, let's define this idea of point pairs. So the word for point pairs, this is the sort of very archaic looking characters, basically because I think they look pretty cool. The point pairing is in Chinese called dui shui, and that's the term you see on the heading of this slide. The first character there, the word dui, has multiple meanings. The word dui even in Chinese even means yes, right? So there are multiple meanings to this character. Here, in this compound term, dui shui, the word means a pair, a couple, to match up, to come together to form a pair, a counterpart. The word, for those of you who know anything about Asian languages, Chinese, both, for example, Chinese and Japanese, I don't know about Korean because I don't speak any Korean, have these things called measure words, right? So measure words are used to describe a number of something. So, for example, a married couple is a 一对夫妇. So it's basically a pair of this husband and wife, right? So the word dui here has this inherent meaning of something that is coupled together. The word shui means an acupuncture point. Now, the image, though, is that it's not just a random pairing, just like hopefully a married couple gets together and comes together and gets along well with one another. If they don't get along well with one another, it's problematic. The word dui has that image of a harmonious coupling, not just any random pairing. And that's one of the things we're going to try to reinforce over and over and over again. Because again, it's not just the throw it in and hope it works, hope it sticks. How can we come up with a strategy to make the pairings not only effective, but more effective because they're a harmonious pairing? They work together well, right? So we have this thing in Chinese called a duilian. Duilian, sometimes you'll see, and these are the lines of Chinese characters, the sayings on either side of this door. So these are basically coupled lines of poetry. Sometimes they're lines of well wishes, but you'll have one line on one side, one line on the other side, and not just randomly stuck up there. They're there as a harmonious coupling that are read together. So a duilian is this coupled line of poetry that gives us, again, this idea of what the word dui is going to be referring to. So then the dui shui are these coupled paired points in acupuncture, which then of themselves are a category of something we called pei shui. Pei shui simply means point combinations, right? So point combinations can be used not only with 2-point, but we're looking at like even larger protocols. So point combinations is how are we putting points together in a larger protocol harmoniously? But before we can understand large protocols, we have to understand the smaller units. Before we understand the smaller units, you have to go back and understand single points, right? So it's a step by step by step, getting from something small to something that can be useful in a more complex way in the clinic. We see the same idea even with duiyao. Duiyao is herb pairs. And this is something that I think we tend to teach, at least when I used to teach, I taught Chinese herbal medicine at Pacific College in New York City for quite a number of years. And I think it's something we tend to teach better in Chinese herbal medicine, at least in my experience as a teacher. So herb pairs also serve as small units that make up larger formulas. So formulas are not necessarily just a random smattering of herbs. Whatever you feel like throwing in the pot, you throw it in the pot and boil it. Ideally, there's some strategy behind how are we creating these formulas. And the precursor to the formula is how are we creating smaller individual units, right? if we understand the smaller units, we understand better how we can apply them in larger combinations to be more effective clinically. And there are certain things, for example, that herb combining does when we're looking at how it creates a formula. And these ideas are going to be fairly similar when we're looking at combining acupuncture points. And again, acupuncture points and herbs are not the same. I said that yesterday a lot. I'm going to emphasize that today. But we can learn something about the value of pairing by looking at how it's described in the herbal tradition. So, for example, in the herbal tradition, one of the functions of pairing has the effect of enhancing the same action. So we can use herbs that basically do a similar job to enhance the effect in the patient beyond what the single herb by itself can do. So some of the examples here would be things like ma huang or guizhi, right? They both have this function of opening the exterior. They're warming, they're acrid, and so they have a synergistic effect. Or da huang and mangxiao similarly have a synergistic effect because they basically do similar things. That's one thing that we can see as a goal of pairing. And again, this is the example of herbs, but we can sort of start extrapolating this and start thinking about how this can be used when we're looking at acupuncture point pairing. The other thing that they can do, for example, is complement one another, which means they don't do exactly the same thing, but they do things that are a useful thing, a useful set of functions that go with one another. For example, we can have a combination of huangqi and dangui, right? One supplements the qi, the other nourishes and moves the blood, which is a useful strategy to combine together, right? Which is, for example, the larger strategy would be something like the Tang, where we have one entire formula that does one strategy, supplementing the qi, and one entire formula that strengthens, nourishes, builds, and slight moving of the blood. But even before we understand that larger formula, it's a good idea to understand those smaller pairs like huangqi and dangui. We can have things like huangqi and fangfeng. One supplements and the other drains and releases the exterior, right? So when we have certain conditions, we might need to use the two of those functions together as a complement for one another. Okay. Some things that other things that we can have is combining opposites to treat more complex cases where one herb alone can't do it. So, for example, we have huanglian and wujuyu. So they can drain heat from the liver and stomach while soothing liver depression, right? One of them clears heat, one of them one is cold and bitter, one is warm and acrid. And so for a complex pattern, we may need to use those two things together. The other thing we can look at is combining herbs to guide the function to specific areas of the body. And we see this with guiding herbs. And I know we've talked about guiding herbs. I know we talked about it more extensively in some of our pain management classes where we did Tung's acupuncture and herbal medicine together. So a guiding herb would be something like the Changho goes to the back of the head, treats headache. Or Baijiu, the Angelica, goes to treat like sinuses and frontal problems. Or the Nyoshi goes to the lower extremities, right? These are guiding herbs. We can see the same thing with acupuncture. So those of you who've studied Tung's acupuncture before know that one of the strategies that and it's not necessarily original strategy that came from Master Tung himself, came from his students, but one of the strategies we can use is this idea of a guiding point. So we can use one point as the main treatment point, and then we can add another point to help guide the effect of that main treatment point into the affected channel, right? So we can use something like Lingu and Dabai on the opposite side of, say, hip pain, back pain, leg pain, foot pain, and then we can put a point in on the affected channel on the same side, sometimes downline, sometimes upline. So that would be an example of a point pairing that is synergistic and guiding, right? So that's another potential option for point pairing, just like we can do similar things with herb guiding. Does it make sense? So these are all things that we can try to accomplish with point pairs, just like we accomplish them with herb pairs. And so we have to start thinking more consciously of how can we accomplish this with our point combining. Okay. So let's go back and talk a little bit about different models of analysis. This will be a review of material we did in part 1. So for those of you who weren't here in part 1, this is going to be some of it. Hopefully none of this is brand new, right? Just like with part 1, and someone said this in I think in the comment box, a lot of this is not, very little of this will be things that you don't already know. We're just trying to put all the pieces together. So everything we taught you in that basic semester 1 foundations of TCM class when you were in school, it actually does matter when it comes to the clinic. It's just a matter of bringing all those threads together and using them to analyze what we're doing over time. So for those of you who weren't here in part 1, this is going to be a quick introduction to some of the concepts we talked about. Why? Because if we don't understand the different models of analysis in specific single points, it's going to be harder to understand the analysis of point pairs, because we're going to use the analysis of single points to help us understand in many cases why point pairs are, why they go together and how they're going to act synergistically in some way. Okay. So for those of you who were here yesterday, this will be just a shorter version of what we did yesterday morning to introduce some of the concepts. So one of the things that we're going to have to take a look at is the interaction of the 5 phases, not only between channels, but also on each individual channel. Remember that every channel in the body has a connection to the 5 phases via the Jing, Ing, Shu, Jing, and He points, the 5 Shu points. This is going to be a fundamental way that we understand how points are doing what they're doing. This will then help us understand why point combinations or point pairings are going to be doing what they're specifically doing. So even though I did say earlier today that the point action versus point indications, point action as the sort of theoretical idea of this point is clearing heat, warming yang, moving qi, whatever, those are primarily a post-World War II creation. And again, I'm not saying it's a bad thing. It's just a thing we should be aware of. It doesn't mean that it was without some sort of antecedent. So it is true that the majority of points in traditional times were chosen based on specific point indications, like disease states or symptom pictures that they went with. It would be overly simplistic to say that there was no concept of point actions. It's just that point actions were not systematically applied to every acupuncture point the way we see in modern textbooks prior to really the middle of the 20th century, right? So every point we look at when we're looking at points like books like A Manual of Acupuncture have a specific action associated with it. And that was not necessarily there historically. But it would be overly simplistic to say that that was just created randomly in the 1950s, because that's also not the case. It's a little bit more complicated. One of the places we see actions being described is through various point categories. So the 5 Shu points were all ascribed certain overarching either actions or disease states that they treated in common as a group. Okay? The Shi cleft points similarly, the source points similarly, the back Shu points, the front Mu points. So point categories became a fairly important thing to study because it gave us an idea of larger concepts and larger trends within what different acupuncture groups did. So let's do a overall review of some of those basic concepts. And if you want a more in-depth understanding, then that you go back to yesterday's lecture. This is just a quick review of some of the summaries of the 5 Shu points. So we know, for example, the Jing Well points treat fullness below the heart. We talked about yesterday how that was really due to a 5-phase interplay, since the Jing Wells, especially on the yin channels, it is true that the yin channels and yang channels are a little different. The Jing Wells primarily have a wood function. Fullness has to do with accumulation, has to do with yin, right? Things that are stuck together. That's what fullness is. The Jing Wells are the most yang of the 5 Shu points. Why? Because they're the most distal, One of the basic ideas, remember, in terms of yin and yang dynamics is distal is yang, proximal is yin. So since they're the most, and right, fingers move a lot more than my elbows. So they're more mobile, means more yang. Elbows, they move, but not quite as many varied directions. Only really does this, right? So it's not as mobile, it's more yin, it's thicker, it's meatier, it's more yin. So if we have something like fullness and accumulation, then we can use the Jingwell points as the yang, the most yang of these points, to help move that type of fullness. We also know that the fullness, swelling, accumulation in the Neijing, for example, are all associated with the spleen. And the 5-phase relationship between the wood points and spleen is a restraining or controlling cycle relationship, which means we can control or scatter or move things associated with the spleen, in other words, accumulation, by needling the wood points. Okay, does that make sense? That's an example of the kind of analysis we did yesterday for the 5 shoe points. So the summary, though, since we don't have time to go through all of these in terms of that. Fullness below the heart, we use them to clear heat. We use them to restore consciousness, and we can understand that again through the different types of mirroring and imaging that we're going to talk about shortly. Treat disorders of the Shen, and we'll talk about why that's the case shortly. The Ing spring points, which are fire on the yin channels, water on the yang channels. They treat heat in the body, changes in the complexion. And just like most acupuncture points, the changes in the complexion don't necessarily have to be solely from heat. So sometimes people interpret this as obviously like redness of the face or something of that sort. But the fire points, for example, don't only clear heat, they mediate the relationship between fire and that particular channel, right? So for example, in Tung's acupuncture, and this will be your first quiz of the day, see who can remember this. You can type it into the box. Which of the points in Tung's acupuncture do we use when we are, let's say someone passes out during acupuncture and they feel like cold, the pain gets worse. Which point do we use, or what's the overlapping point that we use to restore consciousness? Go ahead and type it into the box.
PC8, R8.
Right. So the main point we use is overlapping of heart 8. And that point is in Dong's system called shou jie, which means the releasing point of the hand. It's in zone 2, and I don't remember the numbers because, as I've said before, the numbers in Dong's acupuncture aren't so meaningful. So basically, it's an Ing spring point. And this is not an Ing spring point that's used to treat heat, but rather to restore, so pallor of the face, restoring yang, restoring fire, can be also a function of the Ing spring points, which is why kidney 2, for example, not only clears of acuity heat, but treats problems related to cold or an insufficiency, a problem of yang of the kidney as well. Okay, so again, bidirectionality for many points. Shoestring points treat heaviness in the body, pain in the joints, diseases that happen intermittently, and pain in the joints here in the Chinese, if you can read what it says there, it says shu equals shu. They're homophones. So shu, as in the shoestring points, equals shu pivot. Why? Because the joints are the areas that pivot, right? Which is why it also is diseases that happen intermittently. They come and they go, they come and they go, because they're there and they're not there. They're there and they're not there. That's also this idea of pivoting. So sometimes in Chinese sounds like also means like. The Jing River points treat cough, shortness of breath, changes in the voice. And as we saw yesterday, changes in the voice also sort of suggests, and we see that we can understand the suggestion by looking at specific indications, also sometimes psycho-emotional conditions. Why? Because they laugh uncontrollably would be an example of an indication for a Jing River point. For example, pericardium 5 can treat psycho-emotional disorders. So changes in the voice can be, things like coughing or problems of the actual voice, the throat, but it can also basically suggest psycho-emotional changes as well. The He uniting points treat counterflow qi. They treat diarrhea, disorders of the stomach, and diseases from irregular eating or drinking. So we can understand eventually the diarrhea, disorders of the stomach, irregular eating or drinking, eventually when we're looking at what are the images of where the He uniting points map to on the body. And that we'll take a look at again shortly as a quick review, because that it's important that that material is reviewed over and over again. Counterflow qi, why? Because the word he means to come together. So this is why, again, I said yesterday, please stop saying he si points. The word he in Chinese does not mean sea or ocean. The image, of course, of all of the waters coming together is the sea or the ocean. So if you understand that's what the image is, then you can say he si. If you don't understand what that image is and you don't understand why they call it a sea, then just forget about it. It was a bad translation. The word he means to unite or to come together. And that's because it is the most yin of the Jing, Ing, Shu, Jing, He, which is why it's ascribed the phase of water on the yin channels. And I will argue that the yin channels and the yang channels, even though they're different, the yang channels just have multiple personalities. All the He points fundamentally do this. So they all have some watery nature that we can, but they're also earth on the yang channels. So they can sort of do both. So what is the meaning of water symbolically? Water is winter. Winter is the symbolic movement of coming together and moving in a state of hibernation. The Neijing tells us that the movement of the seasons is birth, that's spring. It's the fulminant aspect of utmost growth, that's summer, harvesting in, which is autumn, and storage, which is winter, which means that those are the movement of the 5 phases. Wood and fire are simply symbols. They're not supposed to be taken literally of that birth of yang that's coming up and out and then growing to its fullest extent. And then metal and water are the movement of yin, metal being the beginning movement of yin, like autumn, and then winter being water as the ultimate aspect of storage, securing, closing in, and holding on. Which is why in the Zhenzhou Dacheng, which we saw yesterday, and in several chapters of the Nanjing, it says that the He points are the area where the yang qi enters into a state of Tsang or storage. Okay. So of course, counterflow qi is stuff going out of storage in the wrong direction. So what do you want to do? You want to put it back in the box. Right? So that's the image of what the He uniting point eventually does, which is also why it treats things like diarrhea. Okay? So that's the image of He uniting. So this is, again, a chart for your reference. Not everyone thinks about these points all the time, but they're going to become vitally important. So in my practice, even though I am primarily a Tung acupuncture practitioner, this is my bread and butter. This I use every day. And why? Because it works really well. If we look at texts like the Nanjing, the Classic of Difficulties, 9+ times out of 10, the only points they're talking about are these points. So if they weren't that important, they wouldn't have spent so many pages of material on talking about these points over and over and over again. And as we saw yesterday, these points are precisely the ones with the widest range of indications over many areas of the body because of their 5-phase associations, because of their anatomical locations, etc. Right? So these are the points that have as many distant indications as they have local indications. Right? Where the points in the trunk tend to be used more for local indications, although we definitely see examples and saw yesterday examples of where that's not always the case. So if you don't have these in your head all the time, keep the chart out in front of you because they will become very important as we go through today's material. And then the next slide, of course, are the yang channels. Remember, and I'm sure most of you are aware, that there is going to be a difference between the 5-phase associations between the yin channels and the yang channels, even though I did say all Jingwell points fundamentally are wood in nature, and I can prove that to you by saying all the Jingwell points restore consciousness, right? Why do they restore consciousness? Because what is being unconscious, right? So you're walking down the street, you see someone unconscious, and you've called 911, but they haven't come yet, and you have to do something. What points do we use to restore consciousness? Aside from points in the trunk, like do 26, we go to Jingwell points. So the Jingwell points basically are giving the body a stimulus of a movement of qi and blood that would be beneficial to that body at that time, right? So think about it symbolically. If a person is unconscious, what movement of the seasons, what season are they stuck in, right? Type the answer into the chat box. What season is someone unconscious stuck in? What is that symbolic movement?
Winter.
Right. So this is the symbolic movement of winter, right? Why? Because they're stuck in hibernation. They maybe don't want to hibernate, but they're stuck there. So what do? You say, here's springtime. Let's wake up. Or in Tung's acupuncture, we skip springtime and go right to the fire point and say, hey, here's summer. Let's get you up and moving. So what we're doing is giving that person a therapeutic stimulus that resonates with a movement of yin and yang, right? So if they're too much yin, we will get them more yang. So for example, some people say that we can choose the Jingyin Shujing He points based on season or time of day. And in fact, the Neijing and the Nanjing, Ling Shu and the Nanjing, even though they disagree, tell us that, for example, in spring, needle the Jing Well point. That's the Nanjing. The Ling Shu says in winter, needle the Jing Well point. They're not both wrong, right? They're both right, I guess, is the best way to put it. One of them is simply saying that obviously the Jingwell point goes with the movement of spring. The other one is saying, if they're stuck in winter, that's you needle because you got to get them out of winter. So do we take that literally? Some people have taught, for example, that, in the early morning, we needle the Jingwell or Ing spring. Later in the evening, if they come to your clinic, let's say they have asthma. In the morning, if they come, you needle lung 10, right? Because no one's coming at dawn, hopefully. Hopefully you're not working that early. And if they come at night, if they come late at night, like closer to closing, then you needle lung 8 or lung 5. And that's also a overly simplistic way. Why? Because if the disease state looks like a certain season, we need to move them out of that season where they're stuck into a more appropriate season. Does that make sense? So when we're talking about the seasonality of points or the timing of points, maybe sometimes we can use it that way, but it's more for me a symbol of how we can start looking at the movement of the 5 phases. Okay, so that's just to say, of course, that even though the Jingwell points on the yang channels are associated with metal, they still restore consciousness. So they still have a fundamental wood nature. They just also happen to be associated with metal. And we can, as Chinese medicine practitioners, we have to get used to living with contradiction and complex layering of ideas, right? So that's just something to keep in the back of your head. Okay, now, what is one of the other ways we can use the Jingyin Shujing He points? So we saw that we have specific functions for the Jingyin Shujing He points. We can have this idea of using them to give a movement of some sort that resonates with one of the 5 phases. We can also use them at a very fundamental level for things like supplementing and draining. And the basic rule that we talked about yesterday, this is a very important rule that I'm sure all of you have heard at some point, is in vacuity, supplement the mother, in repletion, drain the child. First supplement, then afterwards drain. That part we discussed in our Neijing and Nanjing principles with Dong's acupuncture class more in depth. We don't have to go there today. The important part is the first part. In vacuity, supplement the mother. In repletion, drain the child. Okay. This comes from the 69th difficulty from the Classic of Difficulties, and it gives us one of the basic core fundamental ideas of how are we doing supplementing and draining using the 5 phases. Now, to understand the actual needle application of, or at least one of the basic needle applications, probably the most basic needle application of this rule, we go to the 79th difficult issue, which says to withdraw, and bear with me, sometimes this language is a bit tricky the first time you hear it. To withdraw, moving contrary to the direction of the regular flow, means to drain the child. To support, following the proper course, means to supplement the mother. Okay, so what's happening here is the Nanjing is redefining with and against. So there is this idea in acupuncture that you want to supplement with a needle, you angle the needle with the channel to supplement, you angle the needle against the channel to drain. The Nanjing says, no, that's not what this line means that we see in other medical texts. What it means is with and against means needling the mother to supplement or draining the child to drain. So that's the moving with and against. It's not the channel, but moving with or against the normal direction of the cycle of construction or the engendering cycle of the 5 phases. The 79th difficult issue goes on to give us an example. It says, take as an example a heart disease. So what's heart? Heart is fire, right? We have to go back to base. Whenever I ask you, what's the relationship throughout the rest of today, whenever I say, what's the relationship, the first thing you should think about is, what's the yin-yang or 5-phase relationship? Don't think of anything more complicated than that before you think of that first. So take as an example a heart disease, which means fire. To drain at the heart master's shoestring point. Why? Because heart is treated through pericardium, right? So don't worry, it works because they're both fire channels. It works with heart channel or pericardium channel. So the heart master's pericardium is one of the terms they used for pericardium. To drain at the heart master's shoestring point, this is called to withdraw, moving contrary to the direction of the regular flow. In other words, if we want to drain the heart, we go to the shoestring point. Why? Shoestring point is earth. Okay, so that means earth is the child of fire. We drain by draining the child, which means the draining point on the heart or pericardium channel is going to be the shoestring point because it's the earth point. Got it? To supplement at the heart master's Jing well is called to support following the proper course, which means, what do we do if we need to supplement the heart? Heart is fire, pericardium same as fire. The mother of fire is wood. So the way we supplement the heart or the pericardium is we apply a therapeutic stimulus at the Jing well point, heart 9 or pericardium 9. That's the basic way the Nanjing gives us in terms of determining supplementing and draining points. Okay. Now, so that gives us this chart. Let's just talk about this chart for a second. And I think these slides I reproduced them. The next couple of slides are the same. I just duplicated them by mistake. So we're eventually going to skip past that. Okay. So think about it again. This gives us the supplementation points, which is the mother, and then the draining. Don't worry about the middle column for now. Supplementing and draining is done through, in this case, mother and child. Okay. So look at lung, for example. Lung is metal, right? So go back to this other chart. If you're not used to thinking this way, if you were used to thinking this way, bear with me so I get everyone up to speed. So go back to this chart. Lung is metal, which means the mother of metal, and on the top, this is in the engendering cycle, the mother of metal is earth. So if you're supplementing, you supplement at lung 9, which is the earth point. If you're draining, you drain the child, which is the water point, lung 5. So that's how we derive this chart. Lung 9 is the supplementation point. Lung 5 is the draining point. Okay, let's look at large intestine. Just as another example, large intestine is also metal. Now it's a yang channel, so there's going to be slightly different phase associations for the point categories. So we go back here now. Large intestine is metal, which means that the mother of metal, large intestine 11, is the earth, which is the mother. So if we want to supplement strengthen large intestine, we can needle large intestine 11. This is why large intestine 11 also has a as a qi and blood supplementing function. It can clear heat, and the reason it clears heat is because as the earth, it's the child of fire. So if we have heat in the yang ming, we can apply needling to the earth point because earth drains fire, and we do draining needle, ideally, if you're doing supplementing and draining. If yang ming is in a state of insufficiency, we have general qi and blood vacuity, then we can apply supplementing or moxa or something like that onto the earth point, large intestine 11, because it's a supplementing point of the channel, right? Earth is the mother of metal. If we have a excess of metal, excess of large intestine, for example, let's say we have sinus congestion, headache, common cold, then we can drain large intestine 2 as the child or water point, which, because it's the water point, also will have a heat clearing effect on the body. Get the idea? So this is how we derive the supplementing and draining points for each of the channels. And you can derive it yourself from these charts, but I gave you the punchline right here. Okay. Now the middle column here is the origin point, which we usually translate as the Harari point. And I went on my little rant yesterday. We don't have to do it again. No one knows what the word Harari means unless you're an astrologer. So the original Chinese word bun means simple origin or home base. So this is your home base point, right? That's where you came from. That's the same phase. So lung 8 is metal on metal. Large intestine 1 is metal on metal. Stomach 36 is earth on earth. Spleen 3, earth on earth, etc. down the line. Get the idea? That's also going to become important when we're looking at how are we understanding points. All right, that's the real quick review of how we're looking at the 5 phases in terms of specific acupuncture points on the distal extremities. And I apologize again, the next couple of slides are the same. They're just, I put them in twice by mistake. Any quick questions on that material before we go on? I'll give you a second or two to type it in the Q&A box. Anything that's confusing there or we need to go back and take a look at? While you're typing your question before I go on, let me also say that we didn't go into it in depth right here, but there is also the implication, if we can use mother and child, there's also the implication, and some of the genius of later generations of acupuncturists included using control cycle relationships as well. So for example, if you've studied Sa'am acupuncture, Korean acupuncture systems, Sa'am's genius was the systematic association of control cycle relationships to also help supplement or drain. So for example, on the lung channel, lung is metal, fire controls or restrains metal. So we can also use the fire point as a draining point for the channel because it has a scattering and draining effect, right? We can also sometimes do contrary treatment. Instead of supplementing the mother and draining the child, we can sort of flip that on its head, right? And the Nanjing tells us we can flip it on its head. But this is the fundamental, most basic way of doing it. But then we can extrapolate that out to other 5-phase relationships. Okay, any questions on that material? Again, that's a quick review. Hopefully it's a review for everyone, whether you were here yesterday or not. But it's just, I wanted to make sure we're clear on this material.